alaikum. Today we'll be discussing everything about the drug amoxicillin. Here is my group mates Iman, Uqba, Maria and Safia. The contents of our today's presentations are introduction, history and origin, pharmacognosy, pharmaceutical chemistry, administration, how to use it, pharmacokinetics, mechanism of action, uses, contraindication, adverse reactions, drug interactions, dose, toxicity and treatment, and precautions. Amoxil is a prescription medicine used to treat the symptoms of many different types of bacterial infections such as tonsillitis, bronchitis, pneumonia, and infections of the ear, nose, throat, skin, or urinary tract. Amoxil may be used alone or with other medications. Amoxil belongs to a class of drugs called Penicillins, Amino. Pharmacognosy of amoxicillin includes amoxicillin is a semisynthetic drug. It was one of the several semisynthetic derivatives of 6-amino penicillinic acid 6-APA developed by the Beecham Group in 1960s. Penicillin is a family of amoxicillin was the first true antibiotic. It was discovered by Alexander Fleming. While working in the laboratory, he noticed that one of his petri dishes it was dotted with colonies save for one area where a blob of mold was growing. This mold was capable of killing a wide range of harmful bacteria. Further on to the pharmacognosy of amoxicillin, in 1928, Alexander Fleming first discovered that colonies of bacterium Staphylococcus aureus failed to grow in the area of cultures that had been contaminated by the green mold Penicillium notatum. However, in 1940, Howard Florey and Ernst Chain purified the penicillin mold, injected it in the live mice, and initiated human trials. The brands of amoxicillin available today are several Amoxicort, Amoxil, Dispermol, Moxitag, Moxilin Trimox, Amoxil Pediatric, Zimamox, Novamoxin, Gen Amoxicillin, Riva Amoxicillin, Apoamoxy, and several others. Talking about the pharmaceutical chemistry of amoxicillin, this compound belongs to the use of organic compounds known as penicillins. These are organic compounds containing the penicillin core structure, which is structurally characterized by a penum ring bearing two methyl groups at position 2 and an amide group at position 6, as shown below. Amoxicillin sodium is very hygroscopic in nature, while trihydrate is non-hygroscopic. Among free base, sodium salt and trihydrate, amoxicillin trihydrate is the most stable form. The kingdom is organic compounds, superclasses organ heterocyclic compounds, classes lactams, and subclasses beta-lactams. Pharmacokinetics of the amoxicillin. Amoxicillin is stable in the presence of gastric acid and is rapidly absorbed after oral administration. The effect of food on the absorption of amoxicillin from the tablets and suspensions of amoxil has been partially investigated. 400 mg of 875 mg formulations have been studied only administered at the start of light meal. Orally administered doses of 250 mg and 500 mg amoxicillin capsules result in the average peak blood levels 1 to 2 hours after administration in the range of 3.5 mcg per milliliter to 5.0 mcg per milliliter and 5.5 mcg to 7.5 mcg per milliliter respectively. Distribution in the body. Amoxicillin diffuses readily into the most tissues and fluids with the exception of the brain and spinal fluid, except when meninges are inflamed. In blood serum, amoxicillin is approximately 20% protein bound following a 1 gram dose utilizing a special skin window technique to determine levels of antibiotics. It was noted that therapeutic levels were found in the interstitial fluids. The metabolism and excretion of amoxicillin. The half-life of amoxicillin is 61.3 minutes. Approximately 60% of an orally administered dose of amoxicillin is excreted in the urine within 6 to 8 hours. Detectable serum levels are observed up to 8 hours after an orally administered dose of amoxicillin. Since most of the amoxicillin is excreted unchanged in the urine, its excretion can be delayed concurrent administration of probenecid. Mechanism of action. It is a semisynthetic penicillin beta-lactam antibiotic. It is a broad-spectrum antibiotic and is effective against negative strains of Streptococcus species. It inhibits one or more enzymes PBP in the biosynthetic pathway of bactericidal peptidoglycan. Amoxicillin is used to treat middle ear infections, strep throat, pneumonia, skin infections, and urinary tract infections taken by mouth or less commonly by injections. Compete with the transpeptidase to block transpeptidation of peptidoglycan layer, therefore by interfering with the cell wall formation of bacteria. Beta-lactam antibiotics, which binds with the PBP and inhibits cross-linking of peptidoglycan that causes cell wall deficiency in bacteria. They undergo lysis, hence bactericidal effect. Here is the mechanism of action of amoxicillin. Administration of the amoxicillin. Amoxicillin comes as a capsule, a tablet, chewable tablet, and as a suspension in liquid form taken by mouth. It is usually taken every 12 hours, twice a day, or every 8 hours, 3 times a day, with or without food. The length of the treatment depends upon the type of infection that you have. Take amoxicillin at around the same time every day. Here is how to use amoxicillin. Take amoxicillin at the same time each day. Some forms of amoxicillin may be taken with or without food. Check your medicine label to see if you shake your medicine with food or not. Shake the oral suspension before you measure a dose. Measure liquid medicine with dosing syringe provided, or use a medicine dose measuring device, not the kitchen spoon. You may mix the liquid with warm water, milk, baby formula, or fruit juice or ginger ale. Drink all the mixture right away and do not save for later use. You must chew the chewable tablet before you swallow it. Swallow the regular tablet whole and do not crush, chew, or break it. You will need frequent medical tests. If you are taking amoxicillin with clarithromycin or lansoprazole to treat stomach ulcers, all of your medicines are directed. Read the medication guide or patient instructions provided with each medication. Do not change your doses or medication schedule without your doctor's advice. Use the medicine for the full prescribed length of time, even if your symptoms quickly improve. Skipping doses can increase your risk of infection that resistant to medication. Amoxicillin will not treat a viral infection such as flu or common cold. Do not share the medication with other people even if they have the same symptoms you have. This medicine can affect the results of certain medical tests. Tell doctor that treats you that you're using that medicine. Store at room temperature, away from the moisture, heat, and light. You may store liquid amoxicillin in a refrigerator, but do not allow it to freeze. Throw away any liquid medicine that do not use within 14 days after it's mixed at the pharmacy. The shelf life of the amoxicillin expiry is indicated on the packaging. The reconstituted suspension should be used within 4 days. Now, talking about the uses of amoxicillin, it treats a variety of bacterial infection because it's a broad spectrum antibiotic. It treats only bacterial infections, treats infections, and also used to treat stomach ulcers. It's mainly prescribed for sinus. Uses of amoxicillin. Amoxicillin is used to treat a wide variety of bacterial infections. Medication is a penicillin type antibiotic. It works by stopping the growth of bacteria. This antibiotic only treats bacterial infections as stated earlier. Amoxicillin also used with other medications to treat stomach intestinal ulcers caused by bacteria H. pylori, Helicobacter pylori, and to prevent the ulcers from returning. Cautions and contraindications of the amoxicillin. Talking about the contraindications, amoxicillin is contraindicated in patients with a known serious hypersensitivity reaction to other beta-lactams. Patients with allergic or tropic conditions include asthma, eczema, urticaria, and hay fever. Adverse reactions of the amoxicillin. Diarrhea, nausea, and skin rashes are common. Reversible leukopenia, reversible thrombocytopenia, and hemolytic anemia. Severe allergic reactions such as anaphylaxis, serum sickness, and hypersensitivity vasculitis. Hepatitis, jaundice, toxic epidermal necrolysis, black hairy tongue, and superficial tooth discoloration in children, intestinal nephritis, dizziness or convulsions, and meningitis. Drug interactions of amoxicillin. Probenecid decreases the renal tubular secretions of amoxicillin. In common with other antibiotics, amoxicillin may affect the gut flora, leading to lower estrogen reabsorption and reduced efficacy of combined oral contraceptives. Concurrent administration of allopurinol during treatment with amoxicillin can increase likelihood of allergic skin reactions. When testing for the presence of glucose in urine during amoxicillin treatment, enzymatic glucose oxidase method should be used. Pregnancy and lactation. It may be given during lactation and pregnancy, with the exception of the risk at the sensitization associated with the excretion of trace quantities in the breast milk. Here are some of the allergic reactions done by the amoxicillin. Dose of amoxicillin. Adults, teenagers, and children weighing 40 kilograms or more take 250 to 500 mg every 8 hours. Children and infants older than 3 months of age weighing less than 40 kg take 500 to 875 mg every 12 hours. Doses of amoxicillin for different conditions. Acute otitis AOM, the amoxicillin dose is mentioned. For the community acquired pneumonia, it's also mentioned here, which is 80 to 90 mg. For acute otitis, it's 80 to 90 mg. For sinusitis, 80 to 90 mg per kg divided into 2 doses daily. Overdose may result in gastrointestinal effects, should be treated symptomatically. Renal failure has been observed and removed from the circulation. Toxicity overusing of antibiotics. It causes increased fatal diarrhea in children, upset the sensitive gut flora, teach good bacteria to go bad, and increase use of untreatable gonorrhea. How to treat toxicity? Discontinuation of the offending agent and use of anti-epileptic drugs in case of seizures or status epilepticus and hemodialysis in certain cases. Precautions before taking. You should not use amoxicillin if you are allergic to any penicillin antibiotics such as penicillin, dicloxacillin, and oxacillin, penicillin, or ticarcillin. To make sure this medicine is safe for you, tell your doctor if you have kidney diseases, mononucleosis, also called mono, diarrhea caused by taking antibiotics, or food or drugs allergies, especially to cephalosporin antibiotics such as Omnicef, Cefzil, Ceftin, and Keflex, and others. It is not known whether this medication will harm an unborn baby. Tell your doctor if you are pregnant or plan to become pregnant. Amoxicillin can make birth control pills less effective. Ask your doctor about using a non-hormonal birth control condom, diaphragm, cervical cap, or contraceptive sponge to prevent pregnancy. It may not be safe to breastfeed by using the medicine. Ask your doctor about any risks. Here is the references from which we got all of our information. I hope I was able to explain everything about amoxicillin, and I hope it was understandable. Thank you so much.